Hi, I'm Dr. Adem from Valley Advanced Orthodontics, and I'm here to talk about braces versus Invisalign. For adults and for teens, both Invisalign and traditional braces are both viable options. Really is dependent upon the severity of the case, the type of movements we need to make on teeth, and also patient compliance, because whenever we discuss whether or not we want to do traditional braces versus Invisalign, one of the big things we need to talk about is hygiene and compliance with the patient. Because with the trays, you need to wear the trays 22 hours a day, and they need to be taken in and out as needed in order to brush your teeth, in order to clean in between your teeth, floss, do everything like that. But if you don't put that tray back in, that tooth movement we're looking for isn't gonna happen. With the braces, that wire's in there, the braces are on, so the wire is gonna be working 24/7. Hygiene's a little bit more difficult with braces, so it kind of just comes down to whether or not a person feels like they can take care of their teeth with all that extra stuff in their mouth. In terms of the quickness and treatment for Invisalign versus braces, they tend to take about the same amount of time. It really, like I said, comes down to that compliance. If you don't wear your trays or brackets are breaking, it's gonna make treatment time longer. It's gonna take a little bit longer for things to go. So really just comes down to whether or not trays are worn properly or if braces are kept in good shape. When we're talking about complex orthodontic cases, depending on the complexity of a case, that can kind of dictate what we want to do in terms of treatment. So for instance, if a case is an impacted canine or a patient needs some expansion, generally speaking, we'll be looking to do traditional braces as opposed to Invisalign, just because traditional braces are a bit more sturdy and a bit better at getting the type of movement we're looking for when it comes to those types of cases. Cases like anterior open bite, a lot of spacing, Invisalign does actually a better job of treating those types of cases as opposed to braces, and can, generally speaking, decrease that treatment time. Invisalign and our knowledge of how to treat with Invisalign has improved a significant amount. We're able to generate the exact type of movements we're looking for, which we weren't able to do necessarily in the past, but with more studies, more understanding of the treatment modality, we've managed to kind of catch up to braces when it comes to getting the types of treatment outcomes we're looking for. So when it comes to the cost of braces versus Invisalign, at least at Valley Advanced Orthodontics, what we try to do is make that cost the same regardless of what type of treatment you're looking for. So Invisalign, braces, they cost exactly the same. The extra cost in terms of whether you go braces or Invisalign is if any extra appliances are needed on top of that. So if a patient needs an expander, that would cost a little bit more. Generally with expanders, we do braces. But the base cost is exactly the same between Invisalign and braces. And I know not every practice is like that, but our practice wanted to make sure we could do that for our patients. When it comes to the timeline of treatment, when it comes to braces versus Invisalign, there are a couple different factors. First factor is certainly compliance. If a patient isn't compliant, let's say with their Invisalign, they're not wearing their trays the prescribed amount, 22 hours a day, or they're not wearing it for a week long, that could extend treatment because we wouldn't be able to get the exact type of movement that we're looking for with each individual tooth, and would necessitate the fabrication of more trays on top of what we've already made. So that would increase the timeline when it comes to treatment. With braces, to talk about compliance as well, if brackets are breaking, if wires are being pulled out, then that would extend the timeline of treatment, because obviously without that brace on that tooth, you're not gonna get any tooth movement. The other thing to consider when it comes to the timeline of treatment is the complexity of the case. Whether or not we need to do phase 1 or phase 2 solely, or if we need to help bring in an impacted tooth, or if we need to extract permanent teeth in order to get everything to fit a bit nicer. Those are the types of things that could extend the timeline when it comes to treatment. So when it comes to fast versus traditional orthodontics, generally speaking, traditional is the better route, because if you try to speed up the process of treatment too much, that could cause some negative outcomes. So for instance, we want to, in orthodontics, use light intermittent forces in order to get the type of tooth movement we're looking for. But if you speed up the process too much, you put too much force too quickly, it could cause the loss of bone, the loss of roots for those teeth, and could actually compromise the patient. So traditional is definitely the way to go. When it comes to The pain aspect of treatment. Braces take a little bit longer to get used to because if you think about it, you're putting a lot of metal into your mouth. Your gums are gonna take some time to callus up and get used to those braces. And then every time we change a wire and we put new ties onto that wire, you're gonna have a little bit of extra force on that tooth, and then you might feel a little bit of discomfort there. But the pain that you feel with braces should never be too significant. It should usually just be a very slight, dull pain and should never be so bad that you need to come in for an emergency. A couple of tips when it comes to reducing pain during ortho treatment. One of the things I like to recommend to kids is eat some ice cream. Eating ice cream is actually very helpful because you're putting some ice on a kind of sensitive area, so that dulls the pain for you. We usually give orthodontic wax, and it's something that you can actually purchase at your local convenience store or Amazon. And what that wax does is you can put it on a pokey wire, you can put it on a brace that's kind of feeling a little, making your gum feel a little tender. You can put it on there and that can kind of help relieve that pain for a small amount of time in order for you to be able to come in and get that taken care of as needed. When it comes to eating, things are gonna change when you get into braces or an Invisalign, because if you are used to eating really hard substances or candy, anything sticky, those are things that are not recommended to be eaten while you're in treatment, because if it's something sticky, it could possibly pull out a wire, pull out a bracket. If it's something hard, it could knock off either Invisalign attachments or braces. So those are some things that you need to keep in mind when you're making the decision whether or not you want to do treatment. So when talking about sports and you're trying to decide whether or not you want to go with Invisalign or braces, both are perfectly fine options so long as with the braces you use an orthodontic mouthguard. They give a little bit of extra space around the braces, and they aren't the types that kind of mold to your teeth, because if they mold to your teeth, then they have the potential when you're taking them out to take the braces with them. So we have specific orthodontic mouthguards for people that are in treatment, so you never really have to worry about the potential for braces to pop off so long as you're wearing your orthodontic mouthguard. With Invisalign, you can obviously wear the trays and kind of utilize them as a mouthguard, or if you are in the middle of a sport, you can take your Invisalign out and put in a proper mouthguard to kind of protect your teeth. So when we're talking about kids and we're trying to decide, do we want to do Invisalign or do we want to go with braces? The first thing you should ask yourself, is my child mature enough to wear their Invisalign consistently? If you feel like your kid is mature enough to wear their Invisalign consistently, and or you are able to keep them on track with their Invisalign and make sure that they are wearing them consistently, then Invisalign is definitely a viable option. So does your child need early orthodontic treatment? The answer is maybe. The only way to truly know whether or not a child needs early orthodontic treatment is with a consultation with an orthodontist. There are some signs that you could potentially look out for to determine whether or not they might need that treatment. One is you see their teeth are kind of a jumbled mess in the front. They look a little crowded. Generally speaking, children shouldn't have crowding. If you see any crowding, that's usually suggestive that there's not enough space in their arch and they might need a little bit of help making some more space so that they can get all of their permanent teeth into the mouth. So the age-old question of how long do I need to wear my retainers for? The answer has always been and will remain to be for life, so long as you want to keep your teeth in the position they're in after treatment's over. Now, every orthodontist is a little different. Some people say full-time wear for 3 months, some say for 6 months, some say for a year. All of those are totally valid answers, but the for life aspect of it is true amongst all orthodontists. If you want to keep your teeth in the shape that they currently are in, you need to wear your retainers because teeth like to go back to where they were previously. Can my retainers move my teeth back into the proper position? The answer is maybe. It depends on the type of retainer you have. You could either have a metal retainer or a clear retainer. Clear retainers have a harder time of making teeth shift back into their original position. So if a tooth has slightly shifted, there's a possibility that if you have a clear retainer, it could push that tooth back into place. The metal retainers are a little bit better at moving teeth back into their original position because we have more ability to adjust them so that we can actually get that tooth back into the proper position. So it depends on the severity of how much your tooth is moved, as well as the type of retainer you have. So you're an adult, maybe in your 30s or 40s, and you want to know, can I fix my crowding? The answer is yes, of course you can. Now, how we fix that crowding is dependent on a couple of different factors. What you're willing to do, how significant the crowding is, and if we have any residual space. Depending on how severe the crowding is, it might necessitate us taking some teeth out to make more space. Or if the crowding is less severe, we could always do what we call IPR, which is interproximal reduction. It's when we go in between the teeth and kind of just shave off a little bit there. So just off the sides of the teeth here where they touch, and it's usually no more than 0.5 millimeter per contact. So if you have a smaller amount of crowding, we could always do some IPR and make some space. So you have severe crowding and you want to know, are clear aligners just as good at braces when it comes to correcting that severe crowding? The answer is yes. It depends though on the type of orthodontist you have and what their experience is with Invisalign, as well as whether or not the patient has the right amount of compliance and interest in correcting that severe crowding. Regardless of whether or not we're doing braces or Invisalign, in a case where we have severe crowding, many times, or the majority of the time, we're looking to take teeth out in order to give us space so that we can correct that severe crowding. So traditionally, braces is the treatment modality that we would like to use when it comes to extraction cases where we need to, if you can imagine, you take this tooth out and you're gonna be bringing all of these teeth in the front back. It's a little bit easier with braces, but nowadays Invisalign and our technology has improved enough where you can actually do that with Invisalign as opposed to braces. So you're trying to decide whether or not you want to do ceramic braces or you want to do traditional braces. Now, they both work almost the exact same way. The only difference is whether or not it kind of matches what your teeth look like. With the ceramic braces, obviously they look more tooth colored, and we even have wires that in the front here can look like a tooth color. Kind of blends in a little bit nicer with your teeth. With the traditional braces, obviously you're not gonna get that. So it really just comes down to whether or not you want something that looks more tooth colored or something that looks more traditional. Also, to note, with the ceramic braces, with these last two teeth back here, you will have metal braces just because the type of material we use, these ceramics, they can't really go on these big teeth right here because you can see that they are structurally a little different. So you'll only have ceramic braces on the front teeth. So you're trying to figure out what the best age is for your child when it comes to orthodontic treatment and when you should seek out that treatment. So the answer is multifaceted because in orthodontics, we have a phase 1 and a phase 2. Phase 1 is usually when a child has some permanent teeth, but also has some primary teeth. In those cases, we try to treat early because the child either does not have enough space for teeth to come in, the permanent teeth, or teeth might be missing. So we are trying to modify their growth so that all of those permanent teeth can come in and prepare us for phase 2 treatment. Phase 1 treatment usually starts around the age of 6 when we start to see those front 4 permanent incisors come in. So that's usually from 6 to about 10. And then usually there's a bit of a lull, kind of a waiting period between phase 1 and phase 2, where we have all of our permanent teeth finally into the mouth and we're just essentially trying to straighten them out with braces. And that usually occurs between the ages of 11 to 13.